Controversy is swirling once again in the world of public health. A federal vaccine advisory committee, recently reshaped by Health Secretary Robert F. Kennedy Jr., has pulled back from a plan that would have made it harder for people to get a COVID-19 shot by requiring a doctor's prescription. But here's where it gets even more contentious. The meeting descended into confusion, heated debates, and technical hiccups, with members clashing over how vaccine policies should be shaped and by whom. What does this mean for America's ever-evolving approach to COVID-19 vaccination? And could your access be at stake? On Friday, the committee met in Atlanta, led by appointees brought in after Kennedy Jr. removed the previous advisory team. This group, the CDC's Advisory Committee on Immunization Practices, ACIP, faced a pivotal decision. Should people need a prescription before they can receive a COVID-19 vaccine? While some felt this added layer would ensure careful oversight and responsible use, others warned it could become a significant roadblock, especially in states that might implement such guidance more strictly. Ultimately, after much back and forth and palpable tension, the group decided against this drastic step. The prescription requirement proposal resulted in a deadlocked vote, broken by the panel chair, Martin Kulldorff, who voted it down. This means for now, people won't be required to get a doctor's approval before vaccination, though the very idea has sparked fierce divisions among experts and the public alike. Here's what did make it through. The panel voted to recommend the COVID shot for adults aged 65 and older, as well as for younger people, but only through what's called a shared decision-making process. That's a fancy way of saying, talk it over with your healthcare provider first, weighing the pros and cons based on your risk level. So, if you're under 65 and not at high risk for severe illness, your doctor will likely emphasize that your potential benefit is smaller compared to someone more vulnerable. Critics say this approach leaves too much up to interpretation and could create confusion. In addition, the committee urged the CDC to update information sheets about the vaccine, explicitly addressing known and even speculative risks. While some of these concerns have already been debunked or scrutinized heavily, the move signals an attempt at greater transparency. And this is the part most people miss. The CDC typically follows ACIP's advice, but nothing is set in stone until the acting director, Jim O'Neill, formally signs off. The high-stakes conversation didn't stop there. Just the day before, the same committee had voted to curtail access to the MMRV vaccine for children under 4. A decision that has outraged some pediatric experts. And, on Friday morning, they declined to remove the birth dose of the hepatitis B vaccine, a proposal that would have moved the U.S. further from long-standing medical practice. The process itself has drawn sharp criticism. Many clinicians in attendance, including Dr. Sandra Freihofer of the American Medical Association, accused the panel of dismissing evidence-based views and elevating preliminary or questionable data to justify predetermined outcomes. It's troubling to see the erosion of the committee's integrity, Freihofer stated, prompting a wave of concern from major medical organizations. Of particular note, MIT professor Recep Levi, himself a vocal skeptic of some vaccine policies, brought safety worries front and center, telling the committee, "I don't think that the public currently believes the narrative of safe and effective." He was also criticized for waiting until the end of the meeting to disclose what issues would actually be up for a vote. Outside medical groups pressed unsuccessfully for more openness during the proceedings. All of this comes at a time of public confusion. In late August, the FDA restricted the newest COVID-19 boosters to people ages 65 and older, or those with serious underlying conditions, leaving millions uncertain about their eligibility or their options. Bold move or dangerous precedent? While Kennedy's new advisory team has succeeded in shaking up the status quo, it's not clear whether these contentious decisions will ultimately help, hinder, or simply confuse millions of Americans who depend on clear vaccine guidance. And that brings us to the real debate. Are these changes a necessary correction, bringing more personalized and transparent decision-making to vaccine policy, or are they a step backward, jeopardizing public trust and leaving the door open to misinformation? Where do you stand? Do you agree with the panel's direction? Or do you think these moves threaten public health? Let your voice be heard in the comments. This conversation is far from over.